My God, Shelby and John, I think I counted 30 flyers, postcards, the political, and we're at the end, but wow, what a journey this has been.
It has been. And Shelby, I'm sure you remember this, but back in 2016, we had a spike, an unprecedented spike in hotline calls across the country. And the Lifeline got 700 calls from 1 a.m. to 2 a.m. right after Hillary Clinton conceded. And so our crisis community has to be prepared for this election. And I hope they will be. We're always there for people when they need us.
Absolutely. I mean, election anxiety is real. And I know that 988 is going to be there for all Americans.
Absolutely.
The last time we did this was in the height of COVID.
Indeed.
That's right. That's right.
And on that positive note, let's get this podcast out.
Welcome aboard Lifelines with David and John, your guide to charting the transformative course of crisis intervention and the game-changing 988 Lifeline.
Welcome to the Lifelines 988 podcast with David and John. Every week, we're tackling the history and legacy of crisis care, as well as the emergence of 988 and the future next steps of how we get to a system that feels like caring for everyone who reaches out in pain. Watch us, like and subscribe on YouTube or wherever you can listen to us, wherever you get your podcasts. But John, it's great to have such a dear friend and international innovator in this space joining us today. Tell our audience about Shelby Rowe.
Amen, David. How wonderful it is to be sitting here with our dear friend and luminary in suicide prevention circles, Shelby Rowe. Shelby has been working in the crisis and suicide prevention field for over 17 years. And I first got to know Shelby as the director of Arkansas's Crisis Center when she began there in 2007. Of course, now she is a nationally recognized public speaker and zealot for suicide prevention and lived experience, currently transforming the work of SAMHSA's Suicide Prevention Resource Center as the executive director out of the University of Oklahoma. And Shelby's also descended from Chickasaw roots. In fact, Shelby was 2016's Chickasaw Nation Dynamic Woman of the Year. David, our guest today is another special. We are very happy to see you today, Madam Shelby Rowe of the SPRC.
It is so good to be here with two of my favorite people on the planet. And talking about lifelines, talking about crisis care. Mm-hmm. So where do you want to get started?
Well, Shelby, we want to ease in. We want people to learn a little bit about you. Tell us something that maybe our audience wouldn't know about you.
Well, something that they may not know about me is that when I'm not traveling around giving presentations for suicide prevention, I'm also an artist. Created a few pieces that have been award-winning, and my medium is beads. I do beaded portraits, some beaded jewelry. So that would be something that some people may not know.
Well, and if they've watched our Mended Hope Inc. video, they would have seen a little bit of that story in your visit to the Santa Fe Indian art market. The other thing we do to start the program, Shelby, is we think a little bit about what you're a super fan of. We think sports, music, art, books, etc. John, I am a super fan of Native American contemporary art. I didn't know that. The very first AAS conference that I went to was in Santa Fe, and I was not looking forward to that per se, because I thought I'd seen Native American art before, and I got to Santa Fe in 2003, and if I had had money, I would have spent it all. The most amazing next generation stuff. I was just blown away. John, what are you a super fan of?
Thank you for mentioning that art, because you and Eduardo and Sally and I went to Santa Fe and saw just incredible artwork there. And I really, again, like you, had no idea. And that's where Shelby shows a lot of her beaded work, which is outstanding. But yes, I mean, right now I'm a fan of many things, but right now I'm a fan of voting.
A super fan of voting. Okay. All right. Well, voting's cool. And Shelby, John and I have a blank piece of paper. So we're going to do a contest here and you're going to select a winner if there is one. We could also both be cold. But we know you pretty well. So, John, I'm going to say that Shelby is a fan of.
Very fast with his pen. He can do some miracles with his pen. We'll see what happens.
Okay. John, you go first. What do you got, John?
All right. Here we go. You ready?
Let's see it.
Yeah.
What in the world?
Rabbits, right?
It's funny. Yes, there is a story that goes with that. My partner's daughter had a pet rabbit that she was always showing me pictures. And so I had the bright idea of getting her a rabbit for our house, which of course for a 13-year-old, our rabbit is not nearly as cool as her rabbit. She really could care less about the rabbit. So this rabbit is by default my pet and it's growing on me. But yes, I live with a rabbit these days. I think John saw it a few weeks ago when he was in town.
Yes, it was caged at the time, but it often runs around and leaves little gifts for you.
Oh, my Lord. Well, that's a crazy one. Wouldn't have seen that one coming. Shelby said you're a fan of Lily Gladstone.
Oh, yes.
And probably not as much Leonardo DiCaprio, but maybe Leo as well.
I hear through Lily that he's a pretty good guy when you get to know him. I wouldn't know. I haven't had a chance to meet him. But yes, know her through friends, and she is just a beautiful soul inside and out. One of the most talented, most kind individuals that I've ever met. So I'm working on a special bead piece for her that I'm gifting to her, and hopefully I'll be able to get it sent her way before the end of the year.
Is that
maybe she wants something to wear at the Oscars? Who knows?
Maybe so, Shelby. So look, if people have not seen our brief story of your own bead art history, and maybe we'll need to do a follow-up when Lily wears her, what do you call it, Shelby?
It's just a piece of wearable art. It's like a beaded top or a beaded overlay that would go over a strapless dress.
So, John, I think before we keep going, we've got to lift up our sponsor that's bringing this program to us. Tell us about Behavioral Health Link and our crisis software platform.
I'm always happy to do that, David. Beginning her career as a crisis center leader and now a major voice for practice-based evidence and lived experience in suicide prevention, Shelby has been a major force in elevating the presence of people with lived expertise in developing suicide prevention policies, programs, and practices. And this principle guides us in our technology development as well as lived expertise has shaped our BHL platform's state-of-the-industry call center module. We know that every crisis line call is about the relationship between the counselor and the caller. Technology should be at best reinforcing and at least not distracting from that listening and supportive connection. So in developing our software, we gained essential inputs from both our counselors on the lines and prominent certified peer specialists who know the voices on the other side of that line. They made sure that our contact center platform provided person-centered tips and caring reminders to counselors while making required data gathering efforts seamless and non-intrusive. So to learn more about how this lived expertise and studied expertise is built into the DNA of the BHL call center platform, just check us out at behavioralhealthlink.com. David?
So, John, our next segment, the good news. A couple of weeks ago, we lifted up the work, Shelby, that you and the SPRC are doing in terms of lived expertise and the efforts to transform the work that we're all doing together. And actually, John, I reflect back, it was something that caught my eye after Robin Williams tragically lost his battle in 2014. USA Today ran this article, and the headline of 40,000 suicides annually, yet America simply shrugs. And then 4 years later, when Anthony Bourdain and Kate Spade died, they used almost the exact same title of Society Shrugs. So it was a kind of a similar fatalistic sort of article, with the exception that if you look in that subtitle of the 2018 version, but this could be changing our view. And the our view changing element of it, Shelby, was you were in the story of your own coming out about your own lived experience, and that they felt like that was an opportunity for real transformation going forward.
That was such a fun experience. We did a phone interview and they wanted to come and interview me in person. And I was like, well, don't come to my house. Let's meet at the Chickasaw Cultural Center. And so they humored me and, flew into Dallas and drove to Sulphur, Oklahoma. And it was just wonderful to be part of that project. Sometimes as someone with lived experience, the reporters, it's not always a pleasant um, a pleasant thing. And sometimes in the questions that they ask, their own bias or stigma comes through. But that was not the case with this article. Aaliyah with USA Today was just phenomenal.
Shelby and David, I don't know if you remember this, but uh, one of the turning points with USA Today at that time, my sister-in-law, Kirsten Powers, was a columnist for USA Today. And she was being asked by USA Today to write another story yet about suicide. And she said, I don't have anything to say, John. What should I say? And I told her, well, when you tell stories about people surviving suicide attempts, that actually can save lives. So you can play a role as a prominent person in the media and report on how people are recovering and getting through. And she said, well, maybe I should tell my story. And she told her story for the first time out loud to anyone in the paper. And it became the most read USA Today story of the week. And they said, hey, this works. Let's do more of these stories.
Right.
So that stuff does work, Shelby. And your voice and your story really, really made a difference in USA Today as well.
Well, thank you. And I think, there's a lot of people that are worried about sharing their stories. But I found, one, we're not talking about our worst day, at least not for very long. We're talking about survival. And that's a hero's journey, coming back from a life-threatening health event. And they are good stories. They are compelling stories. And I think both of you have played a key role in getting those stories out. John, I know through, when you were with the National Suicide Prevention Lifeline, of really trying to get those lived experience messages out. And then David with the Hope Incorporated, with the series, that docuseries, and then now with Moving America's Soul on suicide, of making sure that when people think about someone, at risk of suicide, that they're seeing in their mind a real person. And I think that's critical work, that it's not some scary boogeyman. We are your next door neighbors, your family, that came back from the absolute worst day of our life that almost ended it.
Yeah, and Shelby, that real person for me, the litmus test of that is that me, or is that a different kind of person, some other person, those other people. Yeah. So that's what I think, that USA Today story. I remember the picture they used of you in it. It was just this very positive, uplifting sort of presentation, and really made a shift on that. Shelby, why don't you maybe go back to your own a little bit origin story? I think John and I would love to hear how you became a crisis center director, how you got into this particular work, and then we'll just follow that thread.
Sure. So I had worked in prevention for a while, in community mobilization, substance use prevention, in that area, community mobilization. And like the story, unfortunately, it starts with a cute boy. Like, I moved out of Oklahoma and Arkansas. I know all good stories start with love.
Stories begin with
crush. Yeah. Good and bad stories start with love. I moved to Arkansas, And I was working at the time in the academic affairs for a university, and one of our adjunct professors had been the clinical director for the Arkansas Crisis Center. And I was working on my MBA, and she had said, "Hey, Shelby, I think you should look at this job. They're looking to hire a director." And I took a look at it, and a lot of it was community outreach and community education and things that I had done. And then there was the hotline. And I was a little intimidated by that at first, but I thought, well, I can learn how to do this. It's like, yeah, that seems a little intimidating. I went to the agency, focused on administrative stuff for about 6 months or so. And then I took our crisis line training and signed up for my first shift. I had thought, well, I'm going to do one shift a month just to be an active director. And I chose Sunday afternoon because I thought, who's
What could happen?
having the
Yeah.
worst moment of their life on a Sunday afternoon?
Right.
Maybe
Right.
I can, just dip my toe in this. And, my very first shift, I got a call from a man that had chronic mental health conditions. He had bipolar disorder. He had recently just gotten out of the hospital, but was still really struggling and really at risk. And so being on the phone with this man from Forest City, Arkansas, which they say For City, and I was looking through my resource guide going, "Sir, I cannot find For City. Like, I would love to help you." And so he stopped and spelled it out. And I was like, okay. like, but helping him to know, it's like if he was having a heart attack, he wouldn't feel bad about going back to the hospital. If he was, having a stroke. So the fact that he was released from the hospital, he shouldn't be ashamed that his condition worsened and he needed care again. And I just started to get really passionate. I think, nearly every week I signed up for more shifts, and just really became passionate about wanting to change the world that our callers lived in and seeing how much courage it took to ask for help and then how hard it was to get good help. And I think, that's when my path crossed with John. And then I think right before I left the crisis line, and part of the reason of that is I went through a divorce. Again, the cute boy. Um, all good stories and bad stories in my life tend to have a cute boy, but it had triggered my PTSD from earlier in my life, from a traumatic
Right.
life event. And I was just really in a bad place. And so it was very humbling to be someone who ran our state's crisis system, who had written our state plan. And I couldn't I couldn't logic my way out of just a PTSD spiral. And it put me in a life threatening crisis. I was acutely suicidal. And so glad that I survived. And then knew I would always stay on suicide prevention, but that I needed to work to get myself off the front line because if I couldn't protect myself, I would be no good to anyone else. But my passion for the field, ironically, had nothing to do with my own personal lived experience. It was those callers, like that man from Forest City,
Yeah.
that was like, how do we help everyone stay safe? How do we help everyone, to want to stay?
Well, and the way you talk about your story now, very naturally, just a part of your natural conversation with us, and I'm sure with others too, about your experience of suicidality. But back when you were in this moment, that was not something a lot of people were talking about, as you know, Shelby. In fact, there were really no crisis center directors out there talking about their experience of suicidality, even though we were talking about the need to really elevate lived experience. And at some point, you made a decision to say, I'm going to tell people as a leader in this field about my experience. Can you tell a little bit about what prompted you to make that decision, what inspired it, and how did people react when you finally did talk about it?
Yeah. So, and it's people that we know that's part of that story. In 2014, the Way Forward report came out. And folks that we know that worked on it, Eduardo Vega, Sally Spencer Thomas, you, John, Jason Paget, some other folks, DeQuincy
Fancy.
Lacine,
Yeah.
and that came out. And Sally reached out, and they were doing a call. I don't know if you remember, they wanted 60-second YouTube videos of like either if you were a person with lived experience or
Yeah.
an ally. And it's like, we put out this request and we're just not getting folks doing these. Will you do a video? And when I saw the request come out, I thought, oh, I should do this because I have lived experience. I'm really excited that suicide prevention is starting to acknowledge this. But I was a little scared. And then when she reached out personally, and I don't know about you, but when Sally texts me personally, I have a hard time saying no.
Does that
And
ever happen to us, David? Ever?
so she texted me and I said, okay. I said, but I'm not an ally. I am a suicide attempt survivor. And so then she instantly called me and she goes, oh, I didn't know. And I'm like, well, no, you wouldn't because I haven't been open about it, but I'll do this. And she quickly gave me, a crash course. She wanted to make sure that I felt supported, protected, and I shared in a way that wasn't harmful to my healing. And I, downloaded guidelines. And she was like, if you need to reach out to Eduardo. And so after reading through, 3 pages, single space, I checked in with Eduardo to make sure that I understood the guidelines. And then you would have thought I was recording something that was going to be broadcast around the world. I reached out to my children and said, hey, I'm going to do this. And I just want to make sure, because it's your story too. I want to make sure that you're okay with this. I reached out to my friends because in the guidelines it said, make sure you tell people because you may feel vulnerable. So I did all of that. I recorded my little 60-second video. And at the time, I was working on applying for a job at the American Foundation for Suicide Prevention. And someone in our field who I respected dearly told me, hey, I don't know if you have your own personal lived experience, but if you do, don't talk about it. It might hurt your career.
Oh.
And I clearly did not listen to them because as soon as I posted my YouTube video, I sent it straight to Christine Moutier and said, hey, I just did this thing, and I wanted to share it because it's related to the work of ASSP. And her response was the greatest. She was like, oh, this is fabulous. I'm so glad you did this. Like, it's not related to your job, but it's nice to know that you have this additional insight and experience. And, if her response would have been different, I don't know if we would be sitting here today. If she wouldn't have welcomed that so openly. And then that fear that if people know, they're going to think less of you or it's going to hurt your credibility, it was just the opposite.
Mm-hmm.
I know I've talked to people that have had real, discriminatory events after they came out. But if nothing else, I hope that my story can help encourage that sometimes it's good. Sometimes the response from the field is very good and welcoming. I think, my little video, and then I may see if I can find it and then we can share it. Cause I think it got like 60 likes and they may have been like me just playing it at conferences.
I like me. That's good. We'll do that again. It's great. We should get that out, David. That's a great suggestion.
It's a great story, Shelby. And look, discrimination is real, and yet there always are going to be people that are supportive and compassionate and caring. And the more that I think people tell their stories, the more it erodes all of that. So terrific. So that, John, is a great segue into our trivia question for the week. And Shelby, the engagement of people with lived experience and their participation in the work is transformative. This is a statement that I got from a group of lived experience participants at the Crisis Now Summit in Amsterdam this summer. And it led to the inclusion of a principle that it's a draft document that we hope to release in the next couple of weeks, but ensuring timely access to care that makes the person feel cared for to the person in crisis. That is a perspective that has been lacking and is really is growing in impact in large part because of people who've been there. So, John, you and we were at, I believe it was the SAMHSA Sprint meeting when they were working on the national guidelines recently, and we stayed in the Sonesta Hotel, in Washington, D.C. And there was a postcard in my room that was about Sonesta, and it said, "Long live the guests." And I was thinking about, because we use the word guest at Recovery Innovations for an individual who is participating in our crisis recovery services. But I started thinking about retreats in particular, resorts, organizations like that. And I thought back to my most significant experience at a resort ever. I spent one night in Kyoto. And Shelby, you were mentioning the ISP conference. It was the ISP regional conference in 2016 for the Asian Pacific area, and visited the Fushimi Shrine, but spent one night in Kyoto, and I went to the Ritz-Carlton for one night. It turns out the Ritz-Carlton is maybe one of the top organizations in the world when it comes to a focus on the guest. And so, John, our over-under trivia question for the week is: a staff member at the Ritz-Carlton is empowered to spend up to X without talking to a manager to resolve any guest challenge. If they're trying to get a guest's experience to where it should be, they can spend X amount and they don't need to talk to anyone. What is X amount, John?
So, I'm sorry, X amount of minutes? Is that what we're talking about?
We're talking dollars.
Oh, I see. Oh, I see.
Amount of dollars. So, John, just for an example, if I'm staying at the Holiday Inn and they happen to have a bar, I guess they wouldn't. But if they did, and I don't like my drink, someone's probably going to have to talk to a manager before I'm getting a new drink without paying. So, and that drink, I don't know what that drink costs, $10, $15, $20. So,
oh gosh, that's a great question. I'm going to say, I'm thinking about, what's the cost of the room there, David?
Oh gosh, it was hundreds of dollars for sure. This is the lobby of that Kyoto, and even the picture doesn't do it justice. It was one of the most magical experiences. Again, I just spent a night there. It was probably, gosh, John, it might have been north of $500.
Well, I was about to say $500 was what I'm going to put the limit at.
All right, so Shelby, your job is to pick over or under. Is the answer for the Ritz-Carlton focused on guest experience that a staff member does not need to go to a manager, is the number higher or lower than $500?
That is tough. Working on a federal grant, I can't do very much without getting permission. But, at the Ritz-Carlton, I don't know. Well, that's tough because 500 was what I was mentally thinking.
John cut it really well. He cut that cookie right down the middle. But it sounds like you're wanting to take the over, but you're reflecting.
Yeah, I think I'm going to be bold and just take the over.
It's the Ritz-Carlton. So unbelievably, John, the number is $2,000.
Oh, wow.
$2,000. So I was looking at this and I found it with the robots and I'm like, yeah, I don't trust that. I got to go to the original links. And I went and researched it. And absolutely, the stories are a little dated there, but this is before COVID that the stories were out about this. But it seems a longstanding effort at Ritz Carlton. And one of the metrics that one of the podcasters was talking about is that they've also done the math on a customer of the Ritz Carlton, and they found that someone who uses most people spend more than one night at the Ritz Carlton. Those who go there over the course of their lifetime spend $250,000 during the course of their lifetime at the Ritz Carlton. So it's really a focus on that guest individual. So,
and David, that illustrates the other part of that phrase that you noted up there from the Crisis Summit about it's not just timely access, it's timely access to caring that feels like caring, which you've got that other part. I would underscore that because $2,000 feels like they really care.
So $2,000 is money, John. I know you're being a little bit coy, but I tell you, if I think of every experience I've ever had with a staff at a hotel in the course of my life, the top one, it's not even close.
Yep.
It was the staff member at the Ritz Carlton in Kyoto.
Yep.
And she said, "Let me walk you to your room," and then spent 15 minutes showing the room and talking about Kyoto. And it was welcoming, it was caring, it was engaging. And again,
that's what it's all about. And that's what that sentence from the folks who, have lived expertise really want is access to somebody that really cares. And that is the emphasis I would put on that statement for sure.
And we think about it for those that are receiving crisis care or that spend a night in a hospital, they're probably paying $2,000 a night.
Yeah, it's not uncommon. That's right. That's right, Shelby. And is the perspective one that's in any way focused on the guest in so many of those interactions? So,
another thing that I've been talking about with David as we were talking about this show, Shelby, is the work that you do for American Indian, Alaskan Native populations and the voice that you brought to that has been so crucial, and it influences so much of your suicide prevention interests and efforts. And you've represented all of that so beautifully at the Oklahoma-based SPRC, more than really the SPRC has ever done. And I just wonder, what are some of the current efforts do you see in the American Indian, Alaskan Native territories that you think are most promising in terms of reducing the abysmal Native American suicide rates? And what do we need to better assure their success?
Yeah. So what I'm going to start with, and first, thank you. That is one of the favorite things. I think anytime we take on new role, new leadership roles, there's new responsibilities. And as being one of the few tribal folks in the spaces that I'm in the rooms and the conversations, it's my honor, responsibility, and privilege to bring all of my tribal relatives with me and try to represent their perspectives. So that's something I enjoy, and it's my responsibility because I notice they're not there. But one of the things that we don't think about is, there's research that's been done. And I'm going to do an awful quote is all, Teresa LaFramboise quoted the research. I should know the name of the original researcher, but it's in Teresa LaFramboise paper that surprisingly language revitalization programs has a link to preventing suicide.
Interesting.
So that, going a little upstream, thought I would surprise you a little with a fun fact, but they found in Canada up towards that with schools, there were some schools that decided all they were going to do is do a bilingual school where you could take language classes and then you could take your history class, your math class, whatever, spoken in your language. That was it. They didn't come in and do training for all the teachers. They didn't train the counselors. They did the language.
Yeah.
The suicide rates for that tribal population dropped for the young people and their families.
Wow.
Yeah.
So just, we often overlook just the harm that was done.
Yeah.
The harm of having think about if in your family, up through 1978, that it was illegal to practice your religious beliefs, illegal to pray how you want to pray. And then children being taken and put in boarding schools, that really had an impact. And so the steps towards healing, the steps towards, when you have generations that for years were punished harshly for speaking their language, that just being in everyday life, getting to speak their language. And so I think things like that of cultural revitalization, but then also I'm very excited about what they're doing in the state of Washington with the Native and Strong Lifeline.
Right.
And that of being, when someone is in crisis, that so far that is the only state that if you are tribal, you can say, I want to talk to a relative. I want to talk to someone else who's Native so I don't have to explain all of this. And I would love to see that that model spread out, not imposed on them, not, oh, you have to do this with the tribal, but if you have that option, that they're using it. And from what I heard, like, they're asking for things like, hey, where is the tribal organization in my area? Or where can I find a traditional healer? When is the next powwow? I haven't been to a powwow since I was a kid. These are those follow-up resources that they're asking for. So I think we underestimate the role of culture, and I think the research is just going to keep showing that more and more, that just giving people the respect and dignity to exist and express their culture is life-saving.
David, I don't know if you've noticed this about Shelby recently, but in hearing you talk about this study that I wasn't aware of in terms of language, that Shelby, I've noticed that a lot of the recent times that you've been talking, I imagine that every time you do public presentations, you start off speaking, is that Chickasaw language you start with?
Yes. I'd signed up we've got a language program in my tribe. We try to be fancy and keep up with technology. So we partnered with Rosetta Stone. But my little type A personality can't handle getting bad grades on pronunciation, but my little Southern drawl won't let me pronounce the words correctly. But yeah, so in Chickasaw, I usually introduce myself and I'll go Chokma, Sahochafo at Shelby, Chikasha Saya. And that's, hello, my name is Shelby. I am Chickasaw.
Love it.
And then, a few years since we're talking on the language, I can't help but say I'd love to be able to share my Chickasaw name, that I had some friends and colleagues that, my family were not unusual. I didn't have an elder to name me and different things. When I talked to my dad, he was like, I don't feel eldery enough to do that. I don't want to mess that up. So I had some others in the tribe helped find my Chickasaw name. And my Chickasaw name is Shlakontfi, which means the one who survived.
Wow.
Terrific.
Oh.
Shelby, such a great intersection that you are leading SPRC doing this work out of Oklahoma. I was looking up, I knew Oklahoma was in the middle of those areas with a lot of tribal culture and diversity and population, but had no idea. John, Oklahoma has the second highest population of Native Americans in the United States behind California. It's the second highest state percentage-wise, with 13% of the population behind Alaska. So it is not only Chickasaw, but Cherokee, Choctaw. Is it Muskogee? Shelby?
Yeah, Muskogee Creek. Yes.
And then Seminole and Comanche. This is how many tribal nations are in Oklahoma, Shelby?
There are 39.
Wow.
And most of us were placed here through the Indian Removal Act and through what they called the Indian Wars. And so I like to call it, kind of the federal treaty version of the get along shirt. There was a meme that said, well, you can't stay where you're from, but we're going to put you all there. So it does make Oklahoma kind of a unique place because we have such diversity. I think we've got a Modoc tribe that was pushed here from California. We've got from the Great Lakes. I think the Pacific Northwest and Alaska are the only places that we don't have cultural representation here. And my tribe came from the Southeast. We were originally in Mississippi, Alabama, and Tennessee.
Right.
But yeah, so Oklahoma, and then they moved us in on top of other tribes that this was their land. So it gets a little complicated, but we're here. It's a very diverse state, and I think recognizing the plurality. One thing as a tribal citizen here is that we know, hey, there's other tribes that do things differently, and I think sometimes when I interact with colleagues that are in states where all of their recognized tribes, that was their homeland, that they've been there for millennia, they're like, well, this is the way.
Mm-hmm.
And then it's like, well, of course, that is the way for your people. Whereas I find my colleagues and other tribal folks in Oklahoma were like, this is my tribe's way. Recognizing that other tribes may do things vastly differently than we do, even from our origin stories. Very different in our state.
Shelby, this was a phenomenal year for SPRC, including the work with the national strategy being revised, as well as the federal action plan. So I asked the robots what in the national strategy had the most potential for impact. I'm going to mention some of these. Tell us on a scale of 1 to 5 how you see this particular element. So enhancing crisis care services was its number one. Improving quality, accessibility, bolstering 988. Where do you see that?
I mean, with 5 being the highest, I would rank that a 5.
Integrating suicide prevention into healthcare. I guess talking about the zero suicide individuals at risk within medical facilities, making sure there are timely interventions.
Can I rank them all 5 or like 7, 5?
That's the thing.
Well, maybe just a comment then. Addressing health equity was the third one from the AI community.
I think health equity is so important because this applies to so many Americans. When we look across rural America, and I think sometimes that term equity, has gotten hijacked in politics. But, that is just as much for, if you are a Black 15-year-old trans teen in Detroit, Michigan, you deserve prompt, caring treatment. If you are a 75-year-old white male veteran in Wyoming, you deserve prompt, caring treatment. And that health equity, I think, we've done such a phenomenal job, and both of you have played key roles, in building a system where everyone has someone to call, someone to come, and somewhere to go. But for rural America, and definitely for reservation-based tribal communities, it's going to take a while before that's fully realized. And so I love that in this version of the strategy, it really challenges all of us to keep that front and center. That call of 988 is for all Americans. It's like, until we know that everyone has those 3 components, we can't stop. We can't stop advocating and pushing. But yes, I'm bringing that into healthcare, because our brains are just as important as the rest of our bodies. So yes, those are all so important, and I'm glad they're there. What else? Is there anything else in the top?
Well, yeah, so two more. And those first three, I don't think existed in the first version of the national strategy at all. But this fourth one definitely did, reducing access to lethal means.
Yes, I think that we at SPRC, we were so happy. We worked with SAMHSA and with the 988 office to develop a new course called Talking About Lethal Means.
Mm-hmm.
And it's for conversations for crisis line workers, because that's something that when they recognize a caller is at risk, every center has their guidelines, and to make sure that we had a uniform training. And I think, there's other trainings that existed. One, a lot of people in our field are familiar with, of CALM. And there were so many crisis line center directors that said, we do CALM, and then we do 2 hours of role plays to make it applicable. Could you just give us a 2-hour training specific for us?
Yeah.
And so we worked very closely with so many in the field. And so far, the first month that it came out, we had over 500 new enrollees. The next month, another 600. We pushed it very hard in October, so I'm hoping that those numbers will double again. But it's our goal that every crisis center, every one part of the 988 network, will take that course and incorporate it in their training.
Just to note how important that is, CALM is really set up for doctors' offices. It's not set up for when a person is actually holding a gun in their hand and are talking to you on the line, and that's what crisis centers need.
Terrific, Shelby. The last one, promoting research and data improvement.
If we can't measure it, we can't improve it, right? And I think there's some things that we're getting better at measuring, but having that there, I think, is really going to challenge all of us on every spectrum of prevention. When we look at, we're going to have to find ways to measure our upstream work. Way back when I worked in substance abuse prevention, and we were at a state meeting, and they were telling us that we didn't have the proof that the substance use treatment folks had because we didn't have bed counts. And I left, and I said to my boss, I was like, I want to make bumper stickers that say the drive-by shooting you did not witness last night was brought to you by your area prevention resource center. And I think that with more measurement and holding that accountability, this is the first strategy that also came with a federal action plan with over 200 commitments, with no new funding, 200 new commitments from over, I think, 30 federal agencies.
Wow.
So yes, that measurement is key, because we can talk about it all day, but this is the first strategy that really included, and how are you going to prove it?
Yeah.
Is that the right 5, Shelby, or did we leave one out?
I think the health equity, but the upstream, the community, this one has such a strong focus on community-based upstream prevention. But other than that, I think you got it.
So I think John will come back to that community question, Shelby. But Shelby, you talked about cute boys earlier. You have 3 boys.
The cutest of all cute boys.
Is the concept of a boy mom, is that a thing, Shelby?
I was a boy mom before TikTok. And I think it's not quite as extreme as that, but.
All right. So here are the 5 characteristics of boy mom. Tell me if that is it you or not. Boy moms are often ready to dive into action. They're playful and adventurous from their playing outdoors, building forts, exploring, and moving. Is that you, Shelby?
Okay, I got one so far. One of the 5. Yeah.
Boys are so curious and sometimes mischievous. It takes a lot of patience and understanding. So boy moms have a heap of that. 2 for 2. Okay. Boy moms focus on fostering independence and self-confidence. Again, these are things you can say about daughters as well, but
absolutely.
Boy moms are tender-hearted and fiercely loving. And empathetic and good listener. Boys often rely on their moms to listen without judgment and offer a safe space to share feelings.
5 for 5, a
Yeah.
solid boy mom.
Nice.
Anything that we left out of that list, Shelby? What's different about having 3 boys? I have
Wait.
2 boys, so.
So you got boys. I would say also a strong stomach for the things that they bring home.
Yeah.
Yes,
Like, look,
yes.
Mom, look at this dead squirrel I found in the yard that they just bring right into your house.
Yeah.
So John, back to Shelby was referencing those upstream interventions.
Yeah, and you mentioned a little bit about the community interventions that you're doing with the new national strategy, as well as what SPRC is focusing on. In fact, we see that suicide rates are increasing consistently, and we need to do things that are different. So it's really exciting to see that SPRC and the national strategy are saying, well, let's do more than just focus on the zero suicide prevention efforts. Let's do something more beyond just trying to enhance the suicide prevention within our health or behavioral health care systems. Let's go into the communities and also look at social determinants of suicide. And I wonder if you could talk a little bit more about those kinds of initiatives that you think are going to have the biggest impact related to community suicide prevention, as well as addressing social determinants.
So there's some things that, we can make the recommendations as SPRC, but to date, I don't have the ability to give individuals financial stability. But I think they're finding, and especially in recent data with veterans, is having that financial crisis is often a precipitator to thoughts of suicide. And so looking at other things of stability, we've partnered with NORC over the last year to do some focus groups in communities because we really want to work on what is needed. We learned information also through formative research we did with 988 and the Ag Council on help-seeking behavior and trusted messengers. And I think until we can equip families, communities, churches, schools with the tools that they need to have those conversations, we'll keep losing lives because so many of those lives are lost before formal care is ever sought. And so much more tools. We're working on projects to get things. Our Lived Experience Advisory Committee is putting together a webinar on how to have a conversation with someone that you're concerned about. And I can't wait to see how they frame that conversation. Because we want more tools like that for family members, that we can't rely on the professionals to get us out of this. We've got to build a world. Janelle Cubbage, who's now at SAMHSA, last year at a conference said, talking about health equity, we need a world where everyone wants to stay. And that stuck with me. And I see that as our charge in the field is we have to build capacity and systems, families, communities to make that possible.
And it's the systems and it's really the families and the people around the individual you mentioned churches, clergy, coaches, whomever that we have to equip. Those are the people who are going to help them feel like they need to stay, as you're pointing out, Shelby. David, that's when you were showing that sentence from the Crisis Summit about timely access to care. There's nothing more timely in terms of access to caring than if you can equip the people around the individual who's in crisis to be there for them, to provide that emotional first aid. That's so important.
Shelby, this has been such a great episode talking with you and so much about Oklahoma. We started with Killers of the Flower Moon with Lily Gladstone and Leonardo DiCaprio. We talked about the rich cultural diversity of the tribal nations. John, we're going to end the segment with Shelby on, John, there are 15 items in the official state meal of Oklahoma. John, we're going to ask Shelby, how many can Shelby name of 13? Now, John, she's either going to take, if you say 5, for example, she's going to say, I can do that, or she's going to pass it back to you. So whoever wins is who can either push the other one to not get it, or they can take it on and get it. So, John, 13 items. Be careful because she'll push it back to you if you overreach. How many items can Shelby name in 30 seconds?
Oh, in 30 seconds, I'll say 10.
10? Oh, my God, Shelby. I would push that back to John if I was you.
Yeah.
We'll see. I don't know. So, and I
Okay.
don't know what the state meal is, but I've got some pretty good
Not a big
guesses.
All right, so Shelby's going to take this on. Shelby, the official state meal has, I'm going to give you some clues, 3 meats, 5 vegetables, 2 breads, and 2 desserts. Tell me when you're ready.
Okay.
All right, Shelby, what you got?
We've got green beans, mashed potatoes, gravy, chicken fried steak, roast beef, fried chicken. We're not that healthy in my state. I can't even think of another vegetable that would be on our Oklahoma. Maybe greens.
Couple
Apple,
more, Shelby. What is it?
cobbler, peach cobbler. How many did I get?
All right, Shelby, you're in the ballpark on all these. Chicken fried steak, absolutely. That's definitely one. Gravy, yes, for sure. Mashed potatoes. Well, let me read them to you, and we'll see that there's some good interaction here. Barbecue pork, chicken
Okay,
fried steak, and sausage with gravy. In the vegetable category, black-eyed peas, corn, fried okra, grits, and squash. In the bread category, cornbreads and biscuits.
Yes.
And the desserts, you said peach cobbler. Oh, I love peach cobbler. Pecan pie and strawberries.
I mean, sounds good. Sounds like Sunday
Sounds
supper.
like Thanksgiving, actually. Yeah, that sounds great.
Apparently, that's the official state meal, John Draper. I'm not sure what to do with that, but
Sponsored by the Heart Hospital? Is that?
And how come tater tots wasn't in there?
no tater tots. So, John, that brings us to the incredibly true tales of Behavioral Health Link.
I've been waiting for that, David.
And, I thought what I'd do is Shelby was super gracious in being a part of a panel of moving America's soul on suicide that we did at the Nashville Summer Conference. I thought I would give a quick update on where we are with the sequel. And Shelby, our goal, which you hit on in your comments in Washington, D.C., we're really trying to punch in the mouth this myth that suicide happens to those people, and rather talk about that suicide happens to all of us who are people. Bad things happen to good people, as Rabbi Kushner talked about. And in fact, if anything, these films are about suicide happens to the best of us. Anyone can get broken and anyone can find a way back. So we've actually already filmed the first 2 segments in outside of Sydney with a traditional Aboriginal corroboree, Shelby, which you don't often, as a white person, get invited into, much less be invited to film. So Joe Williams was tremendous, and Lauren Barham in Sao Paulo, Brazil, who's a psychologist who's written a book about her own suicide attempt. So we've done the first 2. We're trying to make our way with a diverse group from around the world, with Lauren and Joe in Australia and Brazil. Next, we're going to Indonesia outside of Jakarta with actually a Cambridge student, Clarence Sherrill, that we met through some colleagues, has a charity there that supports mothers who are struggling with their newborns. We've met a young woman, Conchita Cruz, who's a triathlete in Mexico City that we're hoping to get to in the spring. Dr. Thomas Joyner was the thread of the first film. We're actually going to go and meet with Professor Rory O'Connor in Glasgow who's written his own book, When It Is Darkest, which he did a little bit of the same thing you did, Shelby, of starting in the field for other reasons, but then sharing about his own emotional inner life. And we have two stories we're still working. We're working with the Mental Health Commission of Canada, hoping to identify a person in Inuit country to participate in the film. And we're working with Vic Armstrong, who, with the Soul Shop effort out of AFSP, is going to Cameroon in the early part of the year. And he has some Black pastors who may be a pool of which we hope to find someone with a church who's willing to talk about their experience. So, John, it took us 4 years. We talked about voting earlier. Actually, we started in that same time period back in 2020 and published the first film earlier this year. And we're hopeful to finish this next film sometime next year.
I am thrilled to see because just a few months ago you were saying, I want to do this, John. How do we do this? And now I'm seeing it come to fruition. Obviously, the reach that we have through the people that care about this work around the world, that's the place to start. And they're finding those folks because finally people are starting to talk about it. But it really means something different in some of those communities to talk aloud about your experience. And I mean, the stigma it's huge here in the United States. Some of these other places, it's even larger. So this is a major effort underway, David, and a courageous one by the folks who want to come forward.
You know, when we started the first film, I had a series of 10 names in my mind already. We have a mature effort in the United States around people, Shelby, like yourself, who've been in USA Today. But many countries don't yet have that infrastructure. Some, it's still dangerous to talk about.
Yeah.
Either suicide attempts. We've had 2 people who wanted to be in the film, but I felt like they were taking undue risk because LGBTQ issues were such a part of their story, and that would put them at risk serious risk in the countries that they live in. So it's been amazing that we didn't know people. I knew Joe Williams in Sydney. But all of these other individuals, with the exception of Rory, we haven't had a relationship with, didn't even know leaders in those countries. So it's been a step at a time of meeting people like ourselves in those countries who then learned about what we were doing and introduced us to people. So it's been fun. Shelby, based upon you saw the first film, what do you hope about this second film?
I am so excited. And David, your relentless commitment and passion for bringing these voices to life is so inspiring. So thank you, because you could say, oh, we told that story, now on to something else. And you keep on going, no, there's more. And I'm so jealous that I didn't get to go and be a part of that with Joe Williams, but we'll come up with something later for that. But it's going to be such a phenomenal film, and I can't wait to be sitting with you in a couple of years when it gets premiered at an international conference. To tears and standing ovations again, I am sure, because just the dignity and kindness, the way that your team is introducing the world to these phenomenal individuals could not be better. So thank you.
Thank you, Shelby. Thank you. It's such an inspiration, and we want to put these sort of stories forward. Doing that Mended film together with you gave us a sense of what these could be, right? And I think opened that door. So, John, that brings us to we need some plain truth today.
We do need some, David. Can you give it to us today?
John, I'm gonna make an effort. We introduced the concept of the Ritz-Carlton and spending $2,000 without a manager's involvement to make a guest's experience what it should be. So let's start with a question that might sound simple, but it is at the core of everything we do, both at Behavioral Health Link as well as at Recovery Innovations, the nonprofit that Shelby and I are part of. Why do we call the people who come to our crisis facilities guests? Now, some might think this choice of words is a semantic twist, softer label, but I'm going to tell you it's much more than that. It's a deliberate stance. It's a shift in perspective. And we're all about challenging the old ways of thinking about mental health and crisis services in particular, just for the very reason that we saw that work from the summit in Amsterdam. We all know that language matters. Words carry power, Shelby, as you were talking about traditional languages that someone's culture has lost by virtue of what's happened. And when you label someone a patient, you're drawing a line in the sand. You're saying that I'm the expert and you're here because you need my help. I hold the answers and you have the problem. That approach, that hierarchy is incredibly limiting in the context of recovery. When you're in a crisis already, you're already feeling that the world is closing in on you. The last thing you need is to have judgment, labeling, or being pushed into a role that further strips your agency and your humanity. And that's where the term guest becomes so powerful. Think about how you feel when you're a guest somewhere. A guest is welcomed, valued, treated with, Shelby, dignity and respect, the words you used. A guest feels like they belong. A guest is getting the message that we want to send to each person who comes through our doors. You're not a problem to be solved. You're a person to be supported, a person with the answers internal to yourself. And Recovery Innovations, this approach just didn't come out of nowhere. It grew from a very purposeful and significant transformation that began when we made a crucial decision back in the early 2000s, and that was to hire hundreds of individuals with their own lived experience of suicide attempts, mental health struggles, substance use challenges, a history of homelessness. That's what began to be a critical, not token, but core part of our teams, the interdisciplinary teams with physicians, nurses, consultants. And it opened the door for people to share their own experience. Shelby, you talked about coming out of your experience. And I still today will go to a conference and have a top leader from a health plan or a state or a provider organization disclose their history of a serious suicide attempt that they've not told anyone because of that discrimination that can be out there. Today, peer supports makes up about a third of our staff at Recovery Innovations, and they work alongside everyone else as essential partners in the care we provide. So imagine walking into a crisis center and being greeted not just by professionals in white lab coats, but by someone who truly gets it, is dressed like you dress, someone who has felt what you're feeling, someone who's been where you are and has made it to the next steps, gainfully employed in doing that very work of supporting people who are having their worst day. That shared experience creates a connection that clinical training alone just cannot replicate. It opens up a space where people feel safe to be real, to be vulnerable, and to take the first steps toward healing. Calling someone a guest is our way of honoring that connection. We see you, we hear you, and we respect you. And let's be real, crisis facilities haven't always been the most welcoming places. Too often they're seen as a last resort, a place people end up because they've exhausted all of their options or because society doesn't know what else to do. This is a place, rather, where you belong. This is a place where you're valued and respected. Our peer supporters are a testament to this resilience and recovery. So when we say long live the guest, we're embracing a philosophy of care that goes beyond traditional treatment models. This approach reshapes the experience of crisis care, not just for our guests, but for our entire teams. We redefine language, we redefine experience. By calling people guests, we're dismantling the stigma, the shame, and the power imbalance that often exists. So long live the guest, John, Shelby. Long live every person who walks through our doors looking for a way forward, every individual who trusts us with their story. Long live the idea that crisis care can be a partnership, a journey, a shared commitment to resilience. Because when we honor each person as a guest, we're doing more than providing a service. We're transforming lives one story at a time.
David, I love it. And that notion of belonging too. I mean, in one hand, for years, people say, you belong in a hospital, you're a patient. And now instead saying, actually, you're a guest in our facility, which not only says we welcome you, but also that's temporary, that you don't belong here forever, but you belong here with us now. And I think that is a beautiful piece of very plain truth. And that's it for us today. And I got to speaking of guests, thank you so much to our good friend who's the guest today, Shelby, for joining us. And please remember to join us next week when we welcome Justin Chase, the CEO of Solari, the outstanding operator of statewide crisis contact services in Arizona, Oklahoma, and Colorado. And today's episode is being released on Election Day. So get out and vote if you haven't already. And also make sure, take your friends and loved ones to vote too. For now, stay cool, stay anchored, and look out for the lifelines that we toss your way next week.